It's nice to see you and Tulu again. What brings you in today?
Well, I noticed that Tulu has been acting differently lately. He has been sleeping more and not playing with his toys as much as he usually does. He's still eating and drinking, but he's not excited about his dinner.
I understand your concerns. I'm just going to ask you a few questions and get some more information about Tulu. Is he on any medications currently?
Just the flea and tick medication once a month that I've been buying from you all.
Okay, that's great. What food is he currently on?
Purina adult cat food. We switched from Iams a while back.
Alright, now is he trying to hide when he sleeps?
Yeah, he's been hiding under the bed, but usually he always sleeps near me. That's when I felt like something was wrong.
So you feel like something is off because he's hiding and sleeping more than usual, but not sleeping with you like he usually does?
Yeah, he is usually very cuddly and wants to be next to me all the time, so for him to be hiding means something is wrong and he doesn't feel well.
Okay, that makes sense. I'm glad you brought him in because usually cats are good at hiding illnesses. For you to notice something is wrong and bring him in right away is a good decision. He's lucky to have an owner like you. Do you have any other animals at your house?
No, it's just me and Tulu. I've had him since he was a little kitten.
Could he have gotten into anything? Plants, medications, or people's food?
No, he can't get any of the food items or medications, and I don't keep plants in the house. He's also an indoor-only cat.
Hello again, Miss Stinnett. How are you today?
Good, thank you.
From the looks of it, it's probably not anything poisonous or something that he ingested to make him sick. First, we'll do our physical exam on him and see if we can figure out what's going on. So I'm noticing there's no visible lumps or masses on him, and his lymph nodes are normal, so there's no infection present. He's walking fine, and there's no issues with his joints. There are also no abnormalities in his mouth or ears, and there isn't any discomfort in his abdomen.
Well, that sounds good. What could be wrong with him then?
Next, I'm going to listen to his heart and lungs to see how they are working. His lungs sound good, but I'm hearing an abnormal rhythm with his heart.
What does that mean?
Sometimes, in cats with heart disease, there can be an abnormal rhythm known as a gallop rhythm. At this age, and being a male, he can be more prone to heart disease called hypertrophic cardiomyopathy. This basically means that the heart is having to pump harder because the heart muscle is thicker, and it's harder for the heart to pump blood to the rest of the body.
Is that serious? Is he going to die? What can we do?
Well, with this disease, cats can develop blood clots and cardiac failure, but he's not showing signs of either, which is good news if we've caught it early on and can slow the progression. What I would like to do next is some blood work as a minimum database, since he hasn't had it done in a few years. This way, we can see how his organs are functioning and what his blood composition looks like. After we see what his blood work looks like, I would like to then do a screening echocardiogram. This way, we can identify the size of the heart muscle to see how severe it may be. The screening echo won't tell us everything about his heart, but it will tell us how enlarged his left ventricle may be.
How much is this going to cost?
I can make an estimate for you and go over the cost. We can go through each step together.
I understand this can be scary, but if we properly diagnose this and figure out the severity, then we can provide some treatment that will make him more comfortable.
Is there a cure for it, or will he need long-term treatment?
Unfortunately, there isn't a treatment for HCM. Depending on how severe it is, when we look at the echo, it can help us determine the prognosis. We have a few options though. I can refer you to a cardiologist if you would like, or we could start some treatment for him here after we perform the diagnostics and go over them with you.
Okay, I would like to do the blood work and the echo today. I will take a look at the estimate, but since it seems pretty serious, I'm willing to pay whatever it takes for Tulu.
Yes, of course. I will get the estimate done for you right now.
I can go ahead and take him back where the technician will get some blood for him to start the blood work. It takes about 15 minutes to run, and then we can see about starting the echo as well. Do you have any other questions or concerns for me right now?
I don't think so. Thank you for explaining everything to me. I just like knowing what's going on.
Of course, we're here for you and I can answer any questions you have. We will take Tulu back now, and I'll be right back with you as soon as his blood work is done.
Thank you.